Welcome to What's Trending, your go-to podcast for staying informed about what's trending in the ever-evolving landscape of Westchester and beyond. We are your hosts, Amanda DePalma, Senior Vice President of Events and Development, and Dr. Marsha Gordon, President and CEO of the Business Council of Westchester.
On today's episode, we're diving into the latest trends shaping healthcare, talent acquisition, and leadership in the modern workplace. Joining us are two industry leaders, Alison Kuhns, the managing partner and founder of Everly Talent, and Beata Mastalerz, the president of Northwell Health, Phelps Hospital. What's Trending is sponsored by Thompson & Bender. Thank you for your support of the BCW Podcast Network.
Looking for unparalleled success in PR and marketing? Look no further than Thompson & Bender, the leader in strategic communications. With over 30 years of expertise, they've mastered everything from PR and advertising to social media and event marketing, ensuring their clients' success. Recognized with awards like the Business Council of Westchester Hall of Fame, City and State Power 100, and voted Best in Westchester for advertising, public relations, and social media by 914 Inc., their track record speaks for itself. Join the ranks of clients from Fortune 500 corporations, small businesses, educational and healthcare institutions, and many more who've benefited from their innovative strategies. Trust Thompson & Bender to elevate your brand to new heights. Welcome, Alison and Beata. Please tell us a little bit about yourselves and your business. Beata, I'll start with you.
Okay, doc. I have a privilege of managing a beautiful team of Phelps Hospital healthcare workers. We are located in Sleepy Hollow, Westchester. Our hospital has 218 licensed beds. We are very proud of providing the best patient-centered care to our patients and driving the excellence and whatever else you might think of when taking care of the patients.
Well, thank you. And fun fact, I was born at Phelps, so gives my stamp of approval.
And
Alison?
Phelps is incredible. I know we'll talk more about your maternal health, and someone told me about your ER hotline yesterday, and just fabulous, fabulous healthcare.
Thanks. Alison?
Thank you, and thank you for having me here today. Everly Talent is a recently founded healthcare and nonprofit recruitment company. We specialize and work with a lot of healthcare organizations and hospitals in the area, as well as a lot of nonprofit partners. I have about 20 years experience in the industry, and I live here in Westchester.
Wonderful.
So let's dive in. As two experts in healthcare, leading a major healthcare center, Beata and Alison, your specialty in recruitment and staffing. What do you see as the biggest challenges facing leaders today? And we'll start with recruitment, Alison, and then talk about retention, which is also part of what you do, burnout, pipeline shortages, and just challenges in the healthcare sector.
I see a lot of challenges, obviously, with clinicians. That continues to be a very big shortage. It doesn't seem to be going away anytime soon.
And what are clinicians?
Nurses, providers, physicians, nurse practitioners. I see a lot of dire areas in social work as well, where there are shortages in those areas too.
And Beata, what are you seeing?
Definitely creating pipelines to healthcare. We see shortages throughout all of the positions within a hospital. And we are very lucky at Phelps, but it's in the entire country you can see shortages, and it impacts the retention because the employees are taking on the extended assignments, they're working harder, they're emotionally tired, and it creates turnover, which then impacts the hospital. Retention is extremely important, and it's a big initiative to make sure that we prevent turnover and prevent disruption in care. And also preventing burnout, right? Making sure that the teams are engaged, that teams are happy and proud of what they do, and they feel supported to make sure that we are here for our patients.
What I love about your executive team, you are an all-female executive leadership team, I think.
I'm very blessed.
Yes. And they are very blessed to have you. And it's very, very important. And I know healthcare has other challenges also.
Yes.
So we can possibly talk about those later.
What would you say are the biggest leadership opportunities that you're both seeing right now, especially when it comes to developing future leaders and then fostering diverse teams?
I could start as in many healthcare organizations, you will see clinicians promoted to a management or leadership roles without the previous training or mentoring or sponsoring opportunities. And what happens is they lead in a wrong way, or they could make mistakes, and that could contribute to the bad culture in a unit, hospital, organization, or contribute to the turnover among the staff. So I believe Northwell does it really well. We have the Center for Learning and Innovation, which focuses on growing leaders, training them of how to look at planning strategically, how to look at financial management, how to change appropriately without disrupting care. And in clinical classes, we don't learn that. We learn how to take care of the patients. Communication is extremely important. Emotional intelligence is extremely important. And those things are not offered by many organizations, and we're very lucky to have that for our leaders and new managers. The other thing is that I mentioned, creating pipelines. We are visible in high schools during the career days. We're trying to spread a good news, but how do the students know what's available in healthcare if they don't have healthcare workers or providers in their family or in their community? I'm not sure if you heard, but during this fall, 2025, Northwell is opening the high school that is going to be available to kids in Woodside, Queens. And by 2028, we're expecting 900 students, which will be learning for free. All of the aspects of technical aspects, being able to get certified, being able to do paid internship in the hospitals or Northwell sites. So a lot of opportunity in thinking differently to make sure that we have providers who could take care of our patients in the future.
And Alison, as you're recruiting people at Everly Talent, and you know the needs of healthcare providers are to have people that are diverse and that can be future leaders, what do you look for in your candidates as you go?
Well, I think it's, you look for somebody who wants to grow, and you look for somebody who wants to help an organization to grow. And I think it's a good point, the mentoring and fostering of leadership skills, because we often get candidates and people who really want to grow in their career, but don't have that experience. And most healthcare organizations that I see in the area want to hire leaders who already have that experience. So it's a little bit of a chicken and egg situation of how do you get to the point where you can foster and grow those people if you're not doing it within, if there aren't, programs set up for that. And but also creating the leadership in the area.
And the candidates that you're looking for, if they know that organization has those programs to develop them, does that make, in this competitive marketplace where there may be a few job offers, does that make it?
It's a huge sell. And I think, and we're talking about retention too. That is something that will keep somebody there if they can find those opportunities to grow within. But I often get a lot of frustration from the people that we are speaking to who want to advance, and they continue to be told, we can't consider you for this leadership opportunity because we need that experience. But how do you get that experience?
And let's talk about the difference between leading teams through change and the difference between management and leadership.
So management is maintaining of daily operations, watching the budget, making sure that the team performs efficiently. And leadership is the development of the strategic vision and leading, inspiring, motivating the teams. And the trick is to include the leadership aspect when training managers, right? So they could become leaders, so they could motivate and inspire their team to be better and more engaged, and hence have a better retention and just a happy employees and a culture in a hospital or institution.
And Alison, you are a leader of a business.
Yes.
So what is your how are you and your partners effective and inspiring leaders?
I mean, I think, management versus leadership. Management is the maintenance. Management is the granular, and leadership is how do you take the skills and the abilities of the people that you have on your team and help them to become the best that they can be. And it's not always a very clear path for, step 1, step 2, step 3. And it's not always the same for everybody. You have different sets of skills, you have different sets of capabilities. And on top of that, not everybody wants to ascend in exactly the same way.
And that's okay.
Absolutely.
That's okay as well.
That kind of is a perfect segue to my next question about, motivation. And what are some ways you inspire your teams to stay engaged and passionate about their work, or how do you encourage people to do the same?
I mean, I think it's a matter of really connecting person to person and human to human. Each person has days that they're not as motivated, days that they're not as productive, and recognizing that and figuring out, it's a little bit of therapy almost, figuring out how do I keep this person engaged with what they're here to do in a way that doesn't feel like micromanagement, doesn't feel overpowering, and enables them to grow in the way that they need to.
For me, I always try to be authentic, and it's very important to me to understand the team that I'm working with and adjust my leadership style to them. As we know, in healthcare, we have 3 major generations of healthcare workers, right? We have our millennials, we have our Gen Zs and baby boomers, and each generation expects different approach. Each generation is looking for different communication styles. Your millennials will be on social media, they will be texting, and they don't want you to be in their face, but they want you to check with them every minute and reaffirm that they're doing the right thing. Your Gen Zs are people that like to be communicated in face and maybe via email, but they don't want you to be checking on them because then they will consider it as micromanaging. And, adjusting and recognizing that and being there for the leaders, I think makes it so important. And your baby boomers, they gave us so much. So they do expect your face-to-face. They do expect you're coming into them and recognizing their legacy and contributions and building on that, right? So finding that understanding and adjusting, I think it's extremely important. Something else that we don't talk about enough, this sandwich generation of healthcare providers and your Gen Zs, for example. There's a huge strain of trying to take care of the children at home and then taking care of their parents. The emotional stress, the physical stress, the financial stress. Sometimes, we don't have enough time to work full time, and we need to sacrifice somewhere. So seeing that, engaging, encouraging, I think it's very important because it's something that is very prevalent, but we don't talk about it enough.
It's very real and it's very
Yes.
human, and every single person brings to work everything that they're carrying with them from home. And I think that that's a great call out because it's very important.
And just to give a tiny little hint, in May, the Business Council of Westchester will be addressing this issue because we are going to be having a conference on
May 22nd.
May 22nd, and the name of it is
Workforce of the Future, and it will be hosted at Westchester Community College. So stay tuned for more details on that.
And it's a good time to say we have particularly in the healthcare field, and Beata, maybe you could talk about this a little bit, the relationship between the colleges and the universities and healthcare, and how, Alison, for you at Everly Talent, and certainly for you at Phelps Hospital, Beata, that pipeline is so important to maintain also. So given Alison, your recruitment and your expertise in recruitment, what positions are you seeing are most in demand and in both the healthcare and the not-for-profit sector? And what are the hiring trends that you're predicting?
We are seeing a lot of hiring in the mental health space. I think, like I mentioned, a lot of social work needs, especially. I think, given the current climate, especially in the nonprofit world, we are seeing great attention to budgeting and fundraising. So a lot of roles that are, donor engagements, fundraising, making sure that organizations have enough to keep going is something we're seeing a lot of as well.
Well, it's interesting because when we think of hospitals and positions and professional positions in hospitals, we always think of kind of hands-on, but there are so many other positions, right, including budgeting and financing and billing and all of the rest as well.
Exactly, and especially in the non-for-profit institutions and hospitals, right? You have to figure out a way of how to support and build on a minimum.
That's right. So from both of your perspectives, how can hospitals, universities, and companies like Everly collaborate to navigate the labor challenges in healthcare?
Being at the table together and talking about what's needed, what are the pipelines that are needed. We are not working enough on technical aspects of patient care. Your radiology techs, ultrasound techs are in a big shortage all around the country, and especially in New York State. So nursing, of course, that's something that we always strive for social workers. Being at the table and understanding of what we need where and helping each other, I think it's extremely important.
I think remembering that we are all part of the same community. As a recruitment partner, we regularly go and present to graduating nursing classes. A lot of them aren't aware of the different paths that they can go in their career and the different jobs that are out there. And, whether or not you're using a recruitment firm or whether you have that capability, we are here and talking to people day in and day out and getting a market expertise. So networking and utilizing information, asking questions such as, what are you seeing? What are people asking for? What are the main complaints when people come and say they want to switch jobs? All of that information, as members of a community here, we can share with each other to collaborate and try to tackle some of these hiring problems.
Yeah, just for curiosity, how did you start your career in healthcare?
I am a nurse.
Yeah, that's it. That says it all, right? Yeah. And that says a lot. And thank you for being a nurse. And I think once you're a nurse, people tell me you're always a nurse, but you are a nurse who is now leading a hospital in one of the largest systems in the country.
87,000 employees.
That's incredible. Absolutely incredible. Congratulations.
Alison, you spoke a little bit earlier about, the motivating and the people looking for the jobs, the potential future employee. What advice do you have for the organizations trying to attract and retain the top professionals?
That's a very good question. I get a lot of frustration, especially from healthcare organizations and nonprofits, because usually what candidates are asking for are more money or remote jobs. And frankly, that's not always possible when you are working under a budget and have constraints, and you can't be a direct care professional and work remotely. So I would say pay attention to the things that you can control. I hear a lot about, candidate customer process, right? So they are participating in an interview process with your organization, and I actually see a lot of people end up accepting a job for slightly less money than they anticipate, and it's because they enjoy the process of the interviewing. So having a streamlined, organized process, giving feedback quickly and promptly, giving the person going through the process expectations about what to expect and next steps. Those are things that you can control that end up highly affecting whether somebody wants to take a job.
Making a difference, yeah.
Thank you.
And so let's shift gears a bit. The way we work is evolving. I know it's harder in healthcare. I mean, it is a patient-centered approach. But how is Northwell Health adapting to trends like remote, hybrid work? Is that possible in any areas of having a profession in healthcare?
Yes, so there is telemedicine, and that's available to patients, and it could be done sometimes from the offsite. Finance is able to work on some days remotely. Around the hospital, you want people more and more, but there's, coding, revenue cycle that could work remotely. You have your discharge nurses. So, for example, what we're utilizing is if we have a nurse that is on medical leave, they could work remotely and telehealth with the patients to teach about medications upon discharge or follow up with the patients after the hospital stay. So being innovative in a way we utilize our team members and listening to what they need. So I think it's very important. That's why I brought up the generations and the sandwich. Yes. And sort of being very vigilant of it to make sure that the employees feel that they're seen and supported.
And speaking of that, the idea with the hybrid work, and Alison, you had talked about really sort of setting the stage for a positive interview and onboarding process. How is AI and technology shaping the hiring process? Anything exciting out there?
I mean, we see it just in our business. You can utilize AI a lot in the nitty-gritty preparation that we do for our jobs. The writing of interview questions, job write-ups, things like that. I do see a lot of organizations post-COVID did not return to on-site and in-person interviews. And I think that has helped tremendously just in terms of moving a process along and, when possible, to do 1 or 2 rounds of a process remotely. So I think technology has helped a lot there, and it really, keeps somebody interested in moving along with the process too.
Great.
Beata, when we recently visited Phelps, I was just amazed at the growth and the expansion and the incredible healthcare that you provide. So can you just talk a little bit about the biggest trends you see shaping the future of hospitals and healthcare, and how at Northwell and at Phelps you're adapting, and then brag about some of that to us, because we want to brag about Phelps.
Well, it's a beautiful campus. We are located on 89 acres. We're very lucky on a Hudson River view, so half of our patients see a beautiful Hudson River from their windows. We are striving to have more and more private rooms. Our very newly renovated mother and baby unit, it's just spectacular.
It is spectacular.
So NICU level 2 is next coming our way. Cancer care is something that we're really focusing on. I think it's very important, and it's holistic, and it should be in our backyard. Also, Northwell look at Phelps as an entryway or gateway into a huge health system that provides whatever the patients might need, starting from research, starting from transplant cares, anything else that the highest cutting-edge technology, world-renowned experts. So it's an entryway from a community hospital that is a boutique and really pushing, to make sure that we provide the best possible care to our patients, to having that support of the huge health system. 21 hospitals is not a joke. It's almost 90,000 employees. It's not a joke.
And research being done, right?
Yes. For
incredible.
Cancer, we work with Cold Spring Harbor. This tells you that's it. We have the top-notch support and expertise available at our fingertips, and we do studies at Phelps. Neurosciences, I think it's extremely important, and that's our growth initiatives. Still, we have Thrombectomy Advanced Center and Center for Advanced Procedures. We can do aneurysm repairs in our Phelps Hospital. And many people in the community don't know that it is right here, done minimally invasive way to make sure that the patients really don't have side effects after. What else? We are building digestive health center in our hospital. We figured out that digestive health illness is something that stays with patients and community for life. So why don't we create something that is readily available to them? Every step of care is going to be in one center. So from diagnostics to seeing nutritionists and to speaking to physicians or surgeons.
Great. So if people want to reach you, if they're interested in healthcare careers or they're looking to hire, where can they find you, Alison?
They can check out our website at everlytalent.com. I am also available on LinkedIn. Feel free to reach out. Networking advice, market advice. Whether or not you can use our services, we are always happy to provide information about what we're seeing out there and candidate experience.
The same here on Phelps website, LinkedIn, Beata Mastalerz, and we're here.
Wonderful, wonderful. Well, thank you so much for joining us today on What's Trending. This has been such an important and insightful and exciting conversation.
It was really a pleasure to have you both. And thank you again to our sponsor, Thompson & Bender. And to our listeners, be sure to rate, review, and subscribe.
Thank you.
Thank you so much.
Be sure to check out the BCW Podcast Network's expansive lineup of shows: Leadership Unleashed, Advocacy and Politics Unplugged, The Member Spotlight, and Nonprofit Voices of Impact. Stay tuned to our next episode of What's Trending, premiering next month. The Business Council of Westchester is the county's largest business membership organization focusing on economic development and advocacy. With over 1,100 members, it is our mission to work for the profitability of our members and the prosperity of the Westchester community. To learn more, go to thebcw.org.